my name is Andrea and I am the clinical lead nurse educator for Southern California, and I want to talk to you today about how you should prep and administer the vaccine JANSSEN, also known as J&J or Johnson & Johnson. So for this vaccine, this is a viral vector vaccine. The colors should be slightly yellow to clear. This vaccine is given IM. This is a one and done dose of 0.5 mL. Let's talk about how we're going to find the expiration date for J&J. For this vaccine, if you're the prep nurse or the charge nurse in the morning, you're going to go get your vaccine out of the refrigerator. You're going to have to scan the QR code to find out what your expiration date is. Then you would go ahead and write it on the box. So what that looks like is you'll get your cellular device out, open up your camera, hover over it, and then it's going to ask you for the lot number, which is there, and you would plug it in. There's also a 1-800 number that you can call, and there's also a website. If you have multiple boxes in the morning, you will have to do this for each box. When it comes to how this vaccine is stored by the manufacturer in the freezer, and then it is shipped to us in the refrigerator between 2 to 8 degrees Celsius. If this vaccine has been untouched and it has been in the refrigerator between 2 and 8 degrees Celsius, it can stay there for up to 3 months. It is very unlikely that you will receive the J&J vaccine and it is still frozen, due to the fact that the manufacturer places that vaccine in the refrigerator to us and then ships it to us. And that takes several hours, right? However, if you arrive to work in the morning and your vaccine is still frozen or partially frozen, what you're going to need to do is you'll take the box of 10 vaccines out of the refrigerator, place them room temperature for 2 hours, and then put them back into the refrigerator. If you just would like to thaw one vial because it was in a frozen state when you received it, you're going to place it at room temperature for 1 hour and then place it back into the refrigerator, or you can use it immediately. It's very unlikely that you will see this vaccine in a frozen state, but if you do, this is just what you'll do to take care of that. Storage after first puncture. After this vaccine has been punctured, this vial can either 1, stay at room temperature for 2 hours, or 2, be returned to the refrigerator for 6 hours. So, this vial will give you 5 doses of 0.5 mL. So, you will draw up your 5 doses under 30 minutes, and then you will return them to the refrigerator for 6 hours without having to subtract the 30-minute draw time. Or you will draw up all 5 of your doses. Say it took you 30 minutes, then you have an hour and 30 minutes left to administer those doses. So if you're just leaving it at room temperature, then you have to subtract the prep time. If you are returning it to the refrigerator and you prep them under the 30 minutes, then you can just go ahead, put them in the refrigerator, and they are good for 6 hours. Let's talk about a few key points for J&J. We do want to keep in mind that this vaccine is viscous and it burns. So when we are administering this vaccine to our patients, we want to make sure that we are pushing this vaccine slowly. Also, when we are pulling up the vaccines with our syringes, we want to pull them up slowly. That way we can reduce the amount of air bubbles. Additionally, for J&J, you don't have to take the vaccine out of the refrigerator and let it come to room temperature. You can administer this vaccine cold. Prepping your dose. So before you prep your dose, of course, we're going to check our expiration date. We're going to make sure that our vaccine is within the date and we are okay to use it. After we check our expiration date, we're going to go ahead and inspect our vial, making sure that it is clear to slightly yellow and there is no particulates floating in it. For J&J, you have to swirl this vial for a true 10 seconds between each dose. You have 5 doses in here, so you would have to swirl and clean this vial 5 times. So make sure it is the true 10 seconds, so you can use Mississippi's, like 1 Mississippi, 2 Mississippi, 3 Mississippi, until you've reached 10. After you swirled your vial, you're gonna go ahead and take an alcohol wipe and you're gonna clean the top of your vial. And you're gonna allow it to air dry. This vaccine doesn't have any preservatives in it. You don't wanna introduce any alcohol into the vaccine itself. For the dose is 0.5 mLs. So we draw back 0.5 mLs of air. Our vial is dry. We're going to go ahead and introduce the air into the vial above the medication because we don't want to disturb it. We will gently invert, draw back our 0.5 mLs, stabilize our vial back on the table, and take the needle out. If you are the prep nurse, you will have to use the one-handed scoop method. Make sure that you're not touching any dirty surfaces with your needle. So go ahead and use one-handed scoop method. Then you're going to hear the click and then give it a little twist. You've punctured this vial, so now you need to put the time and date on this vial. You have to pull up all 5 of your doses within 30 minutes. If you have pulled your doses up, all 5 of them within 30 minutes, you can now return these prep syringes to the refrigerator and they are good to use for 6 hours. You do not have to subtract the 30-minute prep time. Say that you drew up all 5 of your doses and it took you 30 minutes and you have a line of people, so you're not going to return it back to the refrigerator. You now have an hour and a half to administer this vaccine to those people. So if you're using it at room temperature, you do have to subtract that prep time. If you can prep it under the 30 minutes, you can put it in the refrigerator for 6 hours and you would not have to subtract that prep time. After you draw up your vaccine, you are going to verify that you do have the correct dose in there. You want to make sure that it is clear to slightly yellow because this is a viral vector vaccine and that there are no particulates floating in it. At that point, you would go ahead and pass it off to your administering nurse. As the administering nurse, it is your job to verify that your dose is correct once it is handed to you, so this would be considered the second check. So you would check to make sure that in fact you do have 0.5 mLs. This is a viral vector vaccine, so the color should be clear to slightly yellow. If anything were wrong with it, then you would go ahead and just simply send it back to the prep station. Once you verify that your dose is correct and everything looks fine, you will then go ahead and screen your patients. But go ahead and screen your patients. Also make sure that they do give consent to getting vaccinated. So next you would identify the landmarks on your patients. So you would have them turn, drop their arm, and you want to locate the acromion process, which is the bony prominence on the lateral side of your arm. You're gonna go 2 to 3 finger breaths below that. And here would be your injection site into the deltoid muscle. Remember, we give this vaccine IM. So we've located our landmarks. Now we're going to go ahead and prepare to vaccinate our patients. And when we are vaccinating our patients, you guys need to use your best nursing judgment as to which technique you're going to use. Whether it's the Z-track, whether you're going to pinch or you're going to spread the skin. We just want to make sure that we are going IM. Reason being, if we go sub-Q, then our patients can end up with a huge welt on their arm about a week after getting vaccinated. So we're gonna go ahead and we would clean our patient's skin in a circular motion from inner to outer and let it air dry. Once we've cleaned our patient's skin, we're gonna let it air dry. We're gonna get our needle. We're gonna use a dart method when we vaccinate, so we hold it here. We're not gonna hold it here, because if we hold it here, we can accidentally spray out some of the vaccine prior to even puncturing the skin. Or if we hold it here, we can start pushing before we even get all the way into the muscle. So we'll go ahead and uncap. We're gonna use a 90-degree dart method. So 1, 2, 3. Remember, this vaccine is viscous and it burns, so this one we have to push slowly. After the vaccine has been fully administered, you want to just wait a couple seconds. So 1, 2, and then you would pull out at a 90-degree angle. Once you're done vaccinating your patient, this needle is your first priority. We are going to activate the safety lock on a hard surface. We never activate the safety lock with our fingers, because that way we can make sure that we are preventing needle sticks. So you're going to activate your safety lock on a hard surface, and then you would go ahead, drop it into the sharps container. If your patients were bleeding after vaccinated, you will then get a gauze and you would apply pressure until they were no longer bleeding. After that, you would go ahead and apply a Band-Aid. After you've answered all of your patient's questions, you would then provide them with a proof of vaccination card, an EUA fact sheet, and then you will send them off to the observation area for either the 15 or 30 minutes, just depending on how they answered their screening questions.